Today we break ground on a very ambitious project, the surgical and cardiovascular facility expansion. This construction is a place of healing, health, and hope.
This is truly a great day for Evangelical Community Hospital.
This is a unique and promising day.
EVAN is certainly a blessing to all of us and to our rural communities.
So we've come a long way, but it's very exciting to be part of the next page in this very rich history of the Evangelical Community Hospital.
Welcome. Good afternoon. My name is Mike O'Keefe, and I am very pleased to have you join us today for a most exciting day in the future of Evangelical Community Hospital. I thank you for joining us and welcome. This new two-story, 42,000 square foot facility is more than just bricks and mortar. Today we break ground on a very ambitious project, the surgical and cardiovascular facility expansion. This construction is a place of healing, health, and hope. It's a place where members of our community will be able to come to have a state-of-the-art surgical or cardiovascular procedure be performed in a safe, high-quality, modern facility. It is a place where lives will be changed and lives will be saved. It is a place where miracles will happen every day. This new facility is a bold step for Evangelical Community Hospital. It will provide the space, equipment, and technology to ensure that we will be able to deliver the most advanced surgical and cardiovascular care well into the future. What will remain the same is the skill and dedication of our physicians, nurses, technicians, and staff to bring the very best care to the Susquehanna Valley and to do it in a caring and a compassionate manner. I thank you for sharing this special occasion with us. We have many honored guests here today, our physicians, employees, board members, patients, friends of the hospital, and several legislators from across the state and the region. I would like to invite the following legislators to stand and be recognized. From Union County Commissioners, Mr. John Showers and Mr. John Mathias. From Snyder County, Commissioner Malcolm Dirk. Over here, House Representative Russ Fairchild. State Senator Jean Yaw. State Senator Yaw. Representing United States Senator Arlen Specter, Melissa Frey. And representing Congressman Chris Carney, Susan Mathias. Evangelical is a special place, not only to the patients and the family members who come here and receive wonderful care, but also to the hospital and medical staff members who put so much into what they do and how they do it. A great number of individuals have worked very long and very hard to make a dream that grew into a project become a reality. I would like to thank them for their tireless efforts, their great creativity, and their stick-to-itiveness. I thank you very much, personally and professionally. We are indebted to you all. Now it's a pleasure for me to introduce the Vice Chair of the hospital's Board of Directors, Mr. John Griffith. John has served the hospital since 2002. He is currently the Chair of our Finance Committee. John and his wife Sue are active in the community and have been friends of the hospital for many years. John?
Thank you, Mr. O'Keefe. It is an honor for me to be here today on this momentous occasion to bring greetings from Martha Barrick, Chair of the Board, as she is currently in Florida on a long-awaited and well-deserved vacation. This is truly a great day for Evangelical Community Hospital. Since its founding in 1926, EVAN has been a community hospital, serving the community, governed by the community, and supported by the community. I'm reminded of a photograph from 1953 when administrators, physicians, and nurses gathered to break ground for a new modern community hospital. Farmers, business leaders, and community residents brought their shovels and turned the soil for a healthcare facility that has served this region for the next 57 years. Since that time, the hospital has remained progressive, always responsive to the community's needs, providing new facilities, programs, and services. Today, we continue that tradition with the groundbreaking for a new surgical and cardiovascular facility expansion. On behalf of the Board of Directors, I thank you for sharing in this historic day and for your community support of this great community hospital. Thank you very much.
Thank you, John. Not to give away trade secrets, but 1953 has special meaning to me as well. It's now my distinct honor to introduce Dr. Russell Stankiewicz. He's the president of the hospital's medical staff. Dr. Stankiewicz began his work at Evangelical in 1988 after earning his MD degree from the Ross University School of Medicine, completing residencies at the University Hospital of New Jersey, Medical School, and the University of Medicine and Dentistry of New Jersey. He is a senior partner with OBGYN Associates of Lewisburg and is certified by the American Board of Obstetrics and Gynecology, the American Association of Gynecological Laparoscopists, the International Society of Clinical Densitometry, and the North American Menopause Society. Dr. Stankiewicz, straight from the operating room.
Thank you and good afternoon. It's a beautiful day in central Pennsylvania, I think. I've been in the operating room all day. On behalf of the 200 members of the medical staff, we'd like to welcome you here today. This is a unique and promising day. We've all worked toward this day, and we look forward to its carrying us forth in the second decade of the 21st century as we are allowed to provide the best medical care that we're able to provide in today's day and climate. We're grateful for the hospital supporting us in this project. We're grateful to be part of this project. More importantly, we're grateful for the opportunity to take good care of our patients. The opportunity to expand the operating room comes not only at a cost, but also an opportunity. Last year here at EVAN, we performed over 5,100 surgeries. That will change in the future. Many of these surgeries were minimally invasive. We look forward to providing patients the opportunity not only to get back to their families and their routines as quickly as possible, but to provide them with safe and caring medical care. We know that this project has two parts: an expansion of the operating room from 6 rooms to 8 with some additional space for expanded support. Additionally, there will be 16-bed recovery unit, which will also help our patients as they recover from anesthesia. The new cardiovascular suite will have 2 cardiac catheterization labs, 7 patient rooms that will be there for the patients as they proceed, and obviously a comfortable space for patients and family to rest and recline and to enjoy this beautiful weather that we're having as they come out of their procedure. EVAN's unique. We are of the top 5% hospitals in the United States because of the safety grades that all of us on the medical staff, the nursing staff, and all those who participate in providing care for our families and our patients and our friends here at EVAN. We've won that award 4 out of the last 5 years, and we look forward to continuing that tradition in the future. Ladies and gentlemen, it is not only a great honor, but a privilege to look forward to the next decade of the 21st century of leading with excellence every day, the evangelical way. Thank you.
Thank you very much, Doctor. We almost had to slow this down for a little bit because he really was just coming down straight from the operating room. So now it is with great pleasure I would like to introduce our state representative, the Honorable Russ Fairchild. Russ has been an advocate for the hospital and on this important project. It's an honor to have him with us here today. Representative.
Thank you, Mike. It's certainly a pleasure to be here today. In As an old fossil, I can't remember the groundbreaking, but I can sure remember when the hospital was just about the only thing out here. And we take a look at today of the expansion of the hospital, the expansion of the medical services that grew up as satellite units around the hospital, and it's quite an accomplishment. In fact, I was just reading a recent health study that ranked Union and Snyder County as two of the top 5 counties in the Commonwealth as far as healthy living goes. And that's quite an accomplishment, and I think a lot of it has to do with the grassroots efforts that all our healthcare providers put forth, and especially those here in the hospital that make it all work. EVAN is certainly a blessing to all of us and to our rural communities. I believe it's really the cornerstone of what makes this community in this area what it is today, a good place to live. EVAN consistently receives great reviews, as Dr. Stankiewicz mentioned, and it's also among the best when comparing prices or cost for procedures for the patients who are really the customers of this hospital. And it's not easy to get there. It's everybody working together, provide the great and acknowledged services in the same vein, trying to keep cost under control. And everyone has done a great job of that. You know, when you think about a hospital, oftentimes, I think we really take it for granted. But when you take a look at that 24-hour day, 7-day a week, 365 days a year service, that's pretty amazing, and it just goes on and on and on. So to all those staff, administration, the board, volunteers, and I probably missed some here, but you get the flavor. Thank you very much. You just make it happen. Sometimes, I'm sure, just like every job, it's a tough job, a really tough job. But we all owe you a gratitude of thanks. And on behalf of myself, the other elected officials here, we all wish you the very best as you break ground for this new facility that will take us indeed into the future. Thank you very much and good luck.
My name is Roger Haddon, and I have good news for you as it approaches sunny and 70 degrees. I'm the last one to the podium today. So, but I'm here as an EVAN volunteer. I'm on the board at the hospital. I'm also here as an EVAN parent. I have 3 EVAN babies. I did not do that alone. Actually, to be honest, I mostly watched ESPN while my wife was in labor for 12 hours. But I'm a parent, and I'm also a volunteer, and I have the honor and the privilege of serving as the chair for this capital campaign. Actually, we call it a comprehensive campaign because what we're going to announce to you today really isn't just about the bricks and the mortar and the project that we have behind me and that you'll see a little more of when we step outside, but it's about really continuing the viability of the hospital. And just to give you some historical perspective, John mentioned 1953 when they began construction on the facility that we're in right now. If you go back to the 1926 roots of Evangelical Community Hospital, I believe at that time they had 3 doctors that pretty much did everything, and everything meant gallbladders and appendectomies. And then after those docs were done with the gallbladder removal, they usually carried you up a flight of stairs and put you in bed, and that's the way it worked back in 1926. And now we have at least 40 surgeons who perform operations each year at EVAN Hospital. They perform more than 5,000 procedures. So we've come a long way, but it's very exciting to be part of the next page in this very rich history of Evangelical Community Hospital. I alluded a little bit to a campaign that's been going on, and some of you may know about it and maybe some of you don't. It's a comprehensive campaign because growth and excellence does come at somewhat of a cost. And back in January of 2008, we began quietly a comprehensive campaign for Evangelical Community Hospital. And at the time, if you'll recall, I believe the stock market was over 12,000. And then within a year, it slipped more than 5,000 points. And I don't think anybody saw that coming. But it was about January of 2008 that Tammy Radicke and Mike O'Keefe and Martha Barrick and many other great volunteers started going to the True Friends of Evan Hospital and asking for their support of the hospital. And we've been doing so for the last 2 years, and I have to tell you, as somebody who's been on those calls, I really can't tell any difference in the way that people feel about the hospital when the stock market was here in January of 2008 to its lowest point in 2009. No matter what the situation is, people love their hospital, and they appreciate the fact that this hospital stands for an exemplary level of excellence that's hard to find anywhere on the East Coast. So $7.5 million was the goal that our board of directors set to help fund this project. And as I stand in front of you today, we have already raised $5.3 million. So. We couldn't do that without lots of friends, literally thousands of donors. I'd like to mention a few of them right now. OBGYN Associates of Lewisburg, the Central Susquehanna Surgical Specialists, the auxiliaries of the Evangelical Hospital, and also Sun Orthopedics. We'd like to thank them for their support. And they don't like recognition, and they certainly don't want have anything to say, but Jim Apple and Bob Grunland, I have to mention them. Robert Grunland, CEO of Woodmode, and Jim Apple, president of Buttercrust. Collectively, they have served this hospital as volunteers, board members, board presidents for more than 70 years. And they are two individuals, along with their families, that I can honestly say this hospital would not be here without them. And they have agreed to chair as the honorary chairpersons of this comprehensive campaign. Bob and Jim. This is a great hospital, and it is so because of the wonderful doctors, employees, patients, and volunteers. Thank you for allowing me to share this day with you, and soon we get to go outside. Mike?
Thank you very much, Roger. He did not intentionally mean that he was going to be the last one up here, but I am the last one up here. But ladies and gentlemen, this is the moment we've been waiting for. It's my pleasure to invite you to join our guests up here for the groundbreaking, which will happen. Those who can make it, we'd like to have you go right out these doors here and wrap right around out in front of what was the radiology entrance and soon will be part of the, right about where that radiology entrance is now, it'll be just about part of the recovery area for the cardiovascular area. So if you can just close your eyes and imagine, it'll be good. Those who may need assistance, please see some of our staff and we'll help you get out there as well. But anybody is more than welcome to join us, and we'd like to invite some legislative folks to grab the shovel and help throw some dirt with us. So thank you very much for coming here today. We appreciate it. This is a grand chapter, a new beginning again here at the Evangelical Hospital. Thank you for being part of it, and thank you very much for help making it happen. Let's go.